Hey guys, welcome back. I'm the licensed pharmacist. Are you ready to talk about what's been causing the Adderall shortage? Before we get there, let's just cover some basics for those that might not know what Adderall is. Adderall is an FDA approved medication used to treat three main conditions. The first one being ADHD or attention deficit hyperactivity disorder. If I had to guess, this is probably the one you guys are most familiar with. The other two are narcolepsy and binge eating disorder. Well, how does Adderall work? Really what it does is it increases two things. It increases your dopamine and the norepinephrine inside the brain. Turns out when you do this, you have an increase in impulse control and an increased attention when you're focusing on certain tasks. Well, can any of you guess how many prescriptions are sold every single year for Adderall? I'll give you a hint. It's 1 in 10 people. What does that come out to be? Alright, it's 45 million. 45 million prescriptions a year are sold every single year in the United States for Adderall. It's quite a lot. Chances are you're probably one of those people, right? So has it always been this way? Actually, no. Over the past 5 years, we've seen a 25% increase in the prescription usage for Adderall. That's quite a lot. So demand is going up. Well, what's going on with the manufacturers? Why is my pharmacy saying that we can't get Adderall? Well, it turns out they're having a hard time sourcing the active ingredient to make it. So they're having a hard time making it, right? So that means that supply is down. Well, if your demand is up and your supply is down, this creates a situation that we're in. Luckily, pharmacies actually don't price gouge in certain situations like this. The price is just the price and you pay whatever it is that it costs. Well, what are some things that you can do in order to get around this while you're going through this struggle? Well, I'm going to give you a few different options you can go to your doctor and ask for, right? These are not actually direct replacements, and these aren't things that your pharmacy can do for you. But these are just some things that you can talk to your doctor about, so you can tell them, hey, my pharmacy's having a hard time getting Adderall. Maybe we can talk about these things and find out if they're appropriate for me, right? So if you can't get Adderall, there are other things that are used for the same condition, like Concerta, which is methylphenidate, or there's Dexedrine, which is dextroamphetamine. There's also Vyvanse, which is lisdexamfetamine, and there's Strattera, which is atomoxetine, and then there's Intuit, which is guanfacine. Now, like I said, these are really just a few options for you. This is not an entirety list, right? This isn't everything on the market, but these are just the main things that your pharmacy probably has in stock and might be available for you and covered on your insurance plan. Well, hopefully this gives you some insight into what's going on with the pharmacy and why they're saying that they can't get your Adderall prescription filled. All right, be sure and always contact your doctor and go over these things, decide what's appropriate for you. But in the meantime, I hope you guys stay safe out there, and I'll see you next time.